A good laugh and a long sleep are the best cures in the doctor's book. Irish proverb.
Welcome to Living at Your Finest podcast. I'm your host, Dr. Babs. I'm a triple board certified family, obesity, and lifestyle medicine physician, and I am the founder of Living at Your Finest Wellness, a holistic direct primary care practice. Did you know that 80% of lifestyle related chronic diseases within our communities are preventable, with poor diet being the primary culprit? Now, contrary to what we thought, that it was our unfortunate genes, the good news is that we can make changes together to improve our health and quality of life. So that's what this podcast is all about. The Living at Your Finest podcast is devoted to helping families to live at their finest well-being using a holistic approach with a healthy lifestyle to nourish and flourish as a whole, vibrant, and healthy champion. So join me and my guests as we share transformational and sustainable skill sets from our health and wellness journey to support you and your families in achieving optimal well-being. Ready to live at your finest? Well, let's get to it.
Greetings, Living at Your Finest health champions. Welcome back to another episode of the Living at Your Finest podcast show. Thanks for showing up as always. So today I am thrilled about this episode, not just because it's about one of my favorite topics, but my guest speaker today is a new friend. I met him at ACLM, the American College of Lifestyle Medicine, and he's such a wonderful human being. So I really feel honored that he's here with us today to share about his expertise and can't wait to have a conversation with him. The topic today will be about the importance of sleep in reproductive health. And we're going to talk about just the difference in sleep. We're going to talk about going upstream to address our health. But before we get started, I would like to give a brief introduction. So Dr. John McHugh is the chair of the American College of ObGyn District 9. He serves as department chair at Scrip Mercy Hospital in San Diego and the National Medical Director of Accreditation. His interest has always been to improve health and wellness with evidence-based care. So a warm welcome to you, John. It's a pleasure to have you with us at the Living at Your Finest podcast show.
Thank you so much. I'm really honored to be here. I'm really happy.
Yeah, so let's dive right into it. So we're going to be talking about sleep, but before we get to that, I'm always curious about when these passions and these areas of expertise, when they come about, where did that all begin for you? Can you share a little bit about why you're passionate about sleep and just health and wellness altogether? Because I've heard some great things that you've done, places you've been to, climbed and adventure. So where's that passion coming from?
Well, I think, the first thing is we have to talk about our own health and wellness. And I think as an OBGYN, I've had decades of broken up sleep. It's just part of the work that we do. And I think it's really important to address it. I started wondering about it for myself. And as I learned more about the impact on our patients, I thought, boy, I wonder how they're accepting us when we walk into a room with those dark circles under our eyes, clearly sleep deprived, and we're probably not being viewed in the most positive light. So we really have to think about our own sleep. And even given the demands of our profession, I still do overnight call. I'll be working on Sunday overnight, but I think there's a way we can balance it out and we can make it work. Other thing that I'll say, and you know well, the 6 pillars of lifestyle medicine, I think sometimes it can be challenging to talk to patients about nutrition. That's the most common topic, but it's a topic that I'd often say is what we call well defended. My trainer at the gym told me this, or my mother-in-law told me that, whereas sleep is something that we all know that we need more of. So it's really a way to open up that door for
Yeah,
patients.
very good. And I like, I don't think I've ever heard anyone say it the way that you just said it. And so it's very key point that you mentioned that, we as physicians, how are patients perceiving the way we live our lives? And it matters,
Right,
right?
right.
So I thought about it the other day. If you have a dentist and they talk about having this wonderful looking dentition, right? But then you have teeth that just don't look aligned with what you practice. So the same
Yeah.
thing with our physicians. I know I did a little bit of OBGY, but kudos to all our OBGYs that do all the sleepless night. After 5 years of it, I was like, yeah, no, I'm not doing any deliveries anymore. So I definitely respect your role and all the OBGYs that are out there that do sleepless nights. But the fact that you're personalizing it and you're understanding that we have to be that pillar that people see and observe. And how do you balance it? So I really would like you to share just how do you balance that? Because again, as the doctor, you preach the message, okay, your lifestyle interventions, which include sleep, and you're not getting sleep, or maybe you are. Share with us a little bit about how you balance it where you're still showing up at your best.
Well, I'll tell you, one of the things I did when I got involved in lifestyle medicine was I formed a book club and we had a little reading group and we'd all read. And the first thing I'd say to anyone struggling with an issue is try to find something to read about it and learn more. I'm
Yeah.
often amazed how often I see patients that have lived their whole life with polycystic ovarian syndrome or diabetes and never once read a book about it. So I found a book called Why We Sleep by a guy named Matt Walker. It's a fantastic book. I'd recommend it for anyone who sleeps or anyone who needs to sleep more. So what I'd say is it really got into looking at some of the root causes, the root issues of the importance of sleep and also what we can do about it. And I found that for myself, even though I still take nights of call in the hospital, there are things that I can do when there is downtime to
Yeah.
optimize my rest in the hospital. And unfortunately, I'd say some of my colleagues don't take advantage of those opportunities. And hopefully they'll come around, is all I can say.
Yes, yes, and and that's key. A key point. You've mentioned that we do need to avail ourselves of the information that is out there. If you want to improve in a certain area and you don't do that research and do acquire that knowledge, then feel like you're empty altogether, and then you are subject to all the information that is on social media. So
Yeah.
and that was what I did because I had my dad, who is late now, struggled with sleep, and he was a professor at one of the
Mm.
universities in Nigeria, but just struggled with sleep. He had insomnia, was always on one sleep medication or the other. And as the oldest child and the only doctor, he would ask me, what else can I do? And I told him, well, sleep hygiene. That was all they taught us in medical school. And
Hmm.
unfortunately,
Hmm.
after he passed, I had to go and take not the book that you mentioned, but I took a course online about sleep. And I
Mm.
understood the power of sleep because I had to heal myself from chronic insomnia. The message here is loud and clear that we need to see what those pain points are and learn how to correct them, whether with the help of somebody else that is an expert. But the first step is to do the homework. So, can you share a little bit about how you balance the time? Because you've alluded to the fact that there's downtime, and some people might argue, well, I don't know if you've ever heard people say that you sleep when you die, that there's
Yeah.
no rest for
Yeah.
the they say no rest for the wicked, but I say no rest for the hard worker. Please share with us, how do you balance that out? I definitely want to, pick your brain on how you balance that out, especially in your career, in your world.
As you're speaking and you're really helping me really think through how to present this in the most systematic way. The first thing is we need to talk about screening. We need to talk about recognizing when we have an issue. And I can say for myself, it's important in our profession to recognize that we have an issue. We all screen positive, and we're getting away from that term sleep hygiene. It sounds a little clinical, but I think it's important to think about what are the basic fundamental steps. I always say about lifestyle medicine, it's like building the foundation of a house. We
Yes.
really need to think about getting that foundation right, because if we don't have the foundation right, then any treatment's not going to work
Yeah.
well. I was amazed when I looked into some of this, how important temperature is. Temperature is probably more important than daylight cycles for us in terms of sleep. Getting the room nice and cool, and I try to get it down. In fact, last night here in November, I opened up a window to make sure some of that cool night air came in. And probably somewhere around 65 degrees is where we should
Okay.
be to try to get a good night's sleep. I carry sleep masks with me everywhere.
Okay.
Do you ever go into a hotel room and you look around and there's a little light on the TV and there's a little light on the
Yes.
alarm clock and there's a
Yes.
little light here and there?
Yes.
And our call rooms in the hospital are the same way. So let's try to get that light away from ourselves. Be on a sleep schedule whenever possible. Sometimes when I'm on call, I'll put my head down if nothing's happening around 6 o'clock at night. Try to get myself into some rest so that when I get woken up in a few hours, I'm ready to go and get as much sleep as I can with that. I've also started wearing this Apple Watch. I don't know if you or any of your viewers have that. I think Apple Watches are really interesting, giving me some insight
Yeah.
and showing me the opportunities to work on more. But the last thing I'll say, and I think we physicians are abusers of this, alcohol and caffeine. Matt Walker calls it the largest uncontrolled experiment in human history. We've done all this, and we really don't know how
Mm.
much is too much with either of these things. And we should probably be, I try to not have any caffeine caffeine after noon in the day, and I try to not have any alcohol 3 hours at least before bedtime and minimize it overall. There's really probably no healthy level of alcohol.
Yes, yes. And yes, I do wear an oral ring. So when I
Mm.
when during that period of getting the additional knowledge just to really help me optimize my sleep, and it was tremendous. It really gave me some insight to, because again, we say 7 to 9 hours maximum, maybe 7 to 8, but just because you're in bed that number of hours doesn't mean that you're getting that restorative rest. So the oral ring certainly helped. But again, doing that assessment, how do you feel? Do you feel well rested? Do you feel groggy? Do you feel tired?
Yeah,
Those are
sure.
things to pay attention to. And the three things that you mentioned: dark, right? Cool, and it has to be quiet, right? So
Hmm.
those
Hmm.
things are so important to ensuring our sleep. And what I hear you say too is make it possible. I there's a terminology, might not be an English word, but everything is figure outable. So that's what I say in terms of, and it sounds like that's what you, when you're in the call room, if it's nothing is happening, you don't have a baby trying to come out, then you take a nap. So yeah, just finding those little pockets of periods where we can actually feel well rested, even if you can't get it all together. During those
Yeah.
periods where you can't, we have seasons, so make advantage of the downtime that you have. I think it's like when newborn, when you have a mom that has a baby, they say whenever the baby's sleeping, try and get the rest then, and
Yeah.
before
Yeah.
chaos just comes about. So I want to pivot and ask more about reproductive health, because again, your areas of expertise. How does it affect overall reproduction? And I suppose that was what you're referring to about the importance of sleep. We know sleep is so fundamental for immune system, for gut health, all the things that it is. But how so reproduction? Can you share a little bit about how that works for both men and female?
Well, I'll tell you, one of the things, let me just phrase this a little bit. And
Okay.
I'm glad you bring up both male and female health because it's important for both of them.
Yeah.
Obviously, I'm a women's health specialist and have a lot more to say about women's health, but there's definitely data on male sperm count and male hormone levels based on their sleeping habits. Matt Walker poses a really interesting question in the book. Why would something that puts us at such risk through evolution be so well preserved? I don't know if
Mm,
you know this, but whales and dolphins use sleep half their brain at a time, and the other half keeps them floating in the water because they have to sleep at night. It's something that puts us at such great risk. So why would it be so important? It's got to preserve some really important functions for the human body. Some of those functions are, as you alluded to, decreasing your cancer risk. We know that people that have disturbed sleep patterns have higher cancer risk. That happens in sleep cleans out our body. Infection risk. They found that people that were sleep deprived were 500% more likely to get a virus like the common cold. So we know that something that happens during our sleep helps us, and we're finding more and more out about dementia and long-term risk. So something cleaning out our brain during that night is really important. So wouldn't it then also extend to things that happen? And I started looking at issues that happen during pregnancy and found that they're really significant. I'll tell my pregnant patients, when it's time to push, that's like running a marathon. What would you do the night before a marathon? Get a good night's sleep. But unfortunately, they're often not. Some of that is things we do in the hospital, little bumps and beeps and all this kind of stuff that happens. But some of it is, their in-laws texting them and social media and things like that keep people awake at night when they really need that good night's sleep. So we know that C-section rates go down if a woman gets a good night's sleep the night before. We have found a really significant relationship to a condition called preeclampsia, sometimes called toxemia. We know that it's related to diabetes and high blood pressure. We know that diabetes and high blood pressure are related to sleep deprivation. So it would make sense that this would all fit. What they found fascinatingly is that when pregnant women start getting better sleep, their risk of preeclampsia goes down. In fact, it looks like we can start to reverse it with something called CPAP, which is giving somebody a breathing mask so that they get good oxygenation all night long. So without using pills or procedures, we can help cure one of the most common reproductive problems that happen to women.
Thank you so much for joining me on this week's episode. My goal on this podcast is to empower, educate, and encourage you to take actionable steps to triumph at living at your finest, body, mind, and spirit. Of note, the information provided here is for educational purposes only and does not substitute as medical advice. Please discuss your healthcare needs with your licensed medical professional. If you are in need of a compassionate and comprehensive holistic physician or know someone who is, please reach out through my website, livewellness.com, for a meet and greet. It will be my honor to talk to you. Are we connected on social media yet? I share more in-depth content on best practices to ensure that you live at your finest daily. So please join me on Facebook, Instagram, YouTube at Living at Your Finest Wellness, where we can learn together and stay connected. Lastly, please subscribe to iTunes if you have not done so already, and share the podcast within your circle of influence. An extra step? Leave a review and let me know what topics or discussions you would like to hear more of. Thanks in advance. It is always a thing of joy to hear from you. Now, let's get back to today's episode.
Yes, and so nicely outlined. I hope our listeners are paying attention. If this is not going to benefit you, maybe you're not pregnant, or you know somebody that is pregnant, please share this podcast with them, because I mean, Dr. John has so beautifully outlined this, just the importance and the relevance of sleep. So I've always focused on just the non-pregnant person, but I love what you've stated, just the data about reducing C-section and, preeclampsia. I wasn't aware of that data. So thank you for sharing that and highlighting it. Sleep is so important. It's paramount that we, as all mammals, they sleep. They know when to sleep. I mean, I have a dog. I look at him, he just knows when it's time to sleep. But the rest of us, my kids are like, no, I got work. I have social media. I have all the things. So it just appears that it's just culture altogether. And I really hope that the word spreads that sleep is a fundamental part of our well-being. Last night when I was putting my head to bed, I mean, of course, because I've healed from chronic insomnia, I had to learning the cycles of sleep and all the benefits of sleep and seeing what it did to my dad, just breaking down his immune system. I make it a conscious effort to sleep and just turn off the light, whatever it is I'm trying to achieve, I can get it tomorrow. I can continue tomorrow. So, but understanding the relevance of sleep is so important, because about 70% of people are sleep deprived. Is that correct? I think that's where the
That's
data
probably
is.
about right.
Yeah.
Yeah. Yeah.
And so the culture, for me, I know they will text me at night, but then when I said I put in the boundaries, I'm like, I'm sorry, I am not picking any calls unless it's a dear emergency, no calls. And I think that kind of changed the dynamic in my home and my
Yeah.
family members. So we really need to be okay with understanding the importance and the relevance of sleep. And I was mentioning that last night when I was putting my head to sleep, I was just grateful for the opportunity to be able to sleep, because there's
Yeah.
just so much healing that takes place during sleep. So thank you for
You're
sharing
absolutely
that.
right.
Now, do you have any other advice for people that tell you, you know what, I'm just so busy. I can't find a time to sleep, especially, maybe shift workers. I think what you alluded to, take naps whenever you can. But for people that travel, across coast, do you have any advice for them in terms of how to maximize their sleep potentials?
Well, a couple of things I would say. Shift work is recognized as a class 2A carcinogen. That's pretty significant. So that means it's probably carcinogenic to humans to do shift work. And I've done shift work my whole life. I think that we need to know that risk. And if we're willing to take that risk, go into it with an open mind and really think about it. So people should do that. Another thing I would say I think is really important is we have a society that values pills, and sleeping pills are much more likely, actually, women take them twice as often as men. And what they do is they distort the sleep architecture. So they get you to feel like you're sleeping, but you're not having those processes that clean up and prevent cancer and heart attacks. So we found that people that chronically take sleeping pills have higher rates of cancer and heart disease. So we've got to address that. What I will say is there are some other things that do help. In addition to things that you should be careful about, caffeine and alcohol, there are things that you should be a little bit more positive about. Magnesium is one of the things most Americans are deficient in their diet. Magnesium and natural foods is the best, but there are some magnesium supplements that do help with sleep. I also think there's a role for melatonin. It's not fully understood, but it is higher in our intestines already than any pill that we could take. So I think it's probably safe to take. I think it's something someone should discuss with their physician. But I think there are opportunities for melatonin to get you back into that sleep pattern when you need to.
Yes, yes, and the studies that I've come across with melatonin, suddenly for our viewers that are considering it, you want to have that conversation with your physician. I see data that proves that the melatonin helps, is more beneficial for people that travel across different, because that helps them better. Now, in terms of other things that I know, is certainly sunlight first thing in the morning,
Yeah,
right?
yeah, yeah.
Because you get the melatonin converted from the serotonin that you get in the morning first hour sunlight. So there's suddenly several things that can help. The fact that medications, a lot of people feel like they can take all the medications and then that would perceive sleep. You just said it now that it's the same thing, alcohol, it will get you to sleep, but does what's the quality of the sleep, right?
Yeah.
So it's about the quality, the quantity, as well as the consistency of sleep. So well said. Now, together we are part of the Amwell campaign, right? The Healthy Lifestyle Revolution campaign. Would you like to say a few words about why we're even doing it? I think it's so important that we know that these things are very helpful. It enables us to achieve our optimal well-being, but do we do it? But I think in numbers, if we can influence our environment, for me, like I said, my whole home, we've all changed our dynamics to sleep. We tell ourselves, are you living at your finest? We encourage each other. And when we know that we're falling off the rail, we remind ourselves. And I think that's the essence of this campaign, is to encourage each other. So can you share a few words about just sleep itself? How can we promote a culture where people are sleeping more, especially in the hospital, where I've had patients say they could not sleep. It was worse sleeping in the hospital than in their own homes, because every minute somebody is putting a drip or somebody is drawing a line or something like that. So again, just a lot that I've said. Maybe the first thing is what can we do in terms of helping change the culture through this campaign? I think that's the question I'm trying to ask you.
Well, the great thing about your questions is, as you're speaking, I'm thinking about 3 or 4 different answers because it brings up so many great ideas that I want to communicate. How much could we have 3 more days to do this conversation? Because I think I could keep going for 3 days with these great questions.
I know I'm having such a good time. I'm asking you so many. It's as I said, it was one of my most exciting topics: sleep,
Uh,
nutrition, and physical activity. But yeah,
I
go
love
ahead.
it. Well, what I wanted to say first and foremost is it's really fun doing the Healthy Lifestyle Revolution campaign because I feel like a little bit. Do you remember those commercials where after a baseball player would win the World Series, they'd say, I'm going to Disneyland, right? They tell you what they're doing themselves to celebrate. And I think it's important for we physicians to take off our white coats, not pretend like we're the experts, and talk about what we've done in our own lives to make our own lives healthier. And I think that's hopefully a message that hits home for a lot of patients. So I'd encourage all of our colleagues in healthcare to do these short 30-second videos, talk about something that made a difference for your life. I talked a little bit about things that I do when I'm on call, things that I do to get myself on a regular sleep schedule. And I'd like for all of us to try to communicate that. But I will add one more thing I thought was really interesting. A friend of mine is at Stanford, an OB professor, and they had some visitors from China. And the Chinese visitors were touring their labor and delivery. And they asked about what they do with the long-term inductions of labor that they're doing. And they said, well, don't you turn off all the machines at night and let the patients sleep? And the Stanford docs looked at them like they were from Mars. Of course not. We keep going for 3 or 4 days. Imagine that after 3 or 4 days of being kept up at night in an induction of labor to then have to push. No wonder our patients have difficulty. I think there could be a role, and we're trying to incorporate this into some of our management in OB of patients and try to get them a good night's sleep so that when it's time for them to run that marathon, they have the strength to do it.
Yes, yes. Thank you so much. Really appreciate you sharing that. That is very insightful. So now we want to switch gears. I have 1 or 2 questions to get to know you as a person. You definitely are such a gifted human being, but I want to get to know you. So the first question is, what do you do to live at your finest? The name of the podcast is Living at Your Finest. So what way would you say that if you had to pick, what would be your most favorite way to live at your finest well-being?
Well, we had the privilege of having Dan Buettner from the Blue Zones come out and speak to us at the Lifestyle Medicine Conference. And one of the things that he found was that people put some daily activity right into their lifestyle. There's never really been a study saying that if you have a gym membership, you live longer. But there have been many studies that say if you walk, you live longer. And what Dan found also was specifically if you walked up and down a hill every day, you lived longer. Some of the goat herders in Sardinia did very well. I'm lucky enough to live near a beach that has a hill that I have to climb up and down every day. I'm here in California by the coast. So I try to jump in the ocean at least 100 times a year. And I do a nice little hike up and down a hill every day when I do it. And then get that aqua therapy every day for myself, really restorative. That's one of my favorite hobbies.
Lovely. I mean, I feel like I should just adapt that, but I don't live by an ocean or have a up and down here, but I do have stairs in my home, so
There you go.
I can do that. I can do that. Thanks for sharing that. Okay, so let's see. One more question. What would you tell your younger self? I mean, you've accomplished so much, and I really admire just, the breadth and width of all that you've been able to do. But if you look back, was there anything that you would have told your younger self that you would have done different? I'm just curious. Or did you do
Yeah.
everything you had on your list to do?
No, no, I thought something that kind of interesting. It brings up a little bit of emotion for me. So my mother passed away at 92.
Mm,
And she was a stubborn woman, but she was into kind of health food before people were into health food. And she walked every day. She got her exercise, and she used to sprout her own mung beans. Sprouts we know now are probably one of the healthiest foods available. But I think I, like most kids, went through that phase when you're a teenager, thinking, can't I just have a Chef Boyardee like they have on the television set, or maybe a processed food meal? We all thought that was what it was to be a normal American, was to eat that
mm,
processed food. And I kind of wish I'd been a little bit more stubborn when I was a kid and thought, we're doing well on day one, right?
mm.
And we should have stayed with that.
Well, thank you so much for sharing that with us. And I know your mom she's with you, and she knows that you're her precious son, and you're honoring her even now. So, I have something at the practice that says it's never too late and it's never too early to be the healthiest you. So even though you didn't do it as much as you would have loved to at that age, look at you now.
Yeah,
And I know that
great.
you've
I'm trying.
influenced, yeah, and you've influenced so many people around you. I mean, I met you just at LCLM, and I'm like, oh my gosh, all the things I've heard that you've done. And when you said that, I have a 16-year-old, and she tells me, let me live my life. I'm just a kid. So I'm
Yeah,
going to
right,
tell her
right,
what you said now. So maybe she'll think otherwise. But again, there's never, it's the culture that we live in. It's sometimes, parents do the best. And I love that, because not many people, like your mom, very few people lived healthy life before it became healthy. And that's what you're
right,
saying. She was
right,
already
right, right.
doing it. Now, things are picking up. So thank you so much for sharing that with us. And
Thank
I
you.
want to give you an opportunity to just share about anything that you might be doing that is in the works. How can we get in touch with you? I'm sure a lot of my listeners will want to reach out to you. So yeah, please share any parting words and just how we can stay in touch with you.
Well, I think the greatest channel that we're trying to really keep going is Women's Health Lifestyle Medicine on Instagram. I think that's been really popular. And I'm really amazed how just using images and little video clips can really help communicate with people. So that's probably the best way to stay in touch. What we're really hoping to do is to restore that foundation of health. We know that 80% of health is lifestyle choices, and we're trying to bring that into our professional medical associations. As you saw at Lifestyle Medicine, we're trying to bring in new guidelines for management of diabetes. It brings in lifestyle medicine at the foundation. And hopefully, as we talked about with preeclampsia, polycystic ovarian syndrome, we'll really lay that foundation so that we get the 80% done with lifestyle, and then the pills and procedures, if needed, of course, they have a role.
Yes, absolutely. Thank you. It was a pleasure just sharing this space with you today. So thank you.
Great. Thank you. All right.
Right. And to all our listeners, thank you for hanging on to the very end. There's been a lot of nuggets that have been dropped. So, you've listened with your heart, which, now it's time to apply what you've heard. Even if it's just one thing, it's in the doing, right? In the application. So even if it's just, if you need to get an Apple Watch or just something, or just take an inventory of how you feel, just make it a little cooler in the room so that you can sleep. Turn off the lights, drop the phone, and instead of scrolling, because sleep is so important. It decreases our risk of infections. It builds up our immunity when we sleep. So all these benefits and more, we definitely want you to partake of all these great things by ensuring that you sleep. So until next episode, I want you to remember that you deserve to live at your finest, because you are worth it. Take care. Bye, everyone.